Two ways we live our lives. You live number one through your choices, and then of course you live number two through the consequence of your choices. When you see people living today, either in health, out of health, in sickness, whatsoever, even the quality of life that people live is a factor, the choices they made. So it's either you are living your choices or you are living the consequences of your choices.
Welcome to the show on Eco Green Lifestyle TV, where sustainability meets inspiration and we explore the world of sustainable living practices. I'm your host, Elijah Adejimi. Today on the show, we'll be sharing practical tips and expert advice on the theme eco-friendly lifestyle and healthcare insurance. In today's fast-paced world, our lifestyle choices impact not only on our health, but also the planet. Adopting eco-friendly lifestyle promotes a sustainable environment and enhances personal well-being, reducing the risks associated with pollution and climate-related illnesses. However, unforeseen health challenges can still arise, even in green communities. These are like the need for a healthcare insurance scheme that complements an eco-friendly living. Such a scheme ensures financial protection against health emergencies, enabling individuals or families to pursue sustainable living and practices with peace of mind. Through the integration of health insurance with eco-conscious living, communities can secure their health while minimizing their ecological footprints, creating a holistic approach to wellness and environmental care. Welcome to the show. I have with me on the show today the Executive Secretary of your State Health Insurance Agency, Dr. Sola Akande. You're welcome, sir.
Thank you very much. Good day to all our viewers across the globe.
There's a strong connection between our lifestyle choices and health, particularly how we relate with the environment. Sir, can I ask, how does our lifestyle choices impact on our health?
Okay, thank you very much. A very reasonable question. Two ways we live our lives. You live number one through your choices, and then of course you live number two through the consequence of your choices. So when you see people living today, either in health, out of health, in sickness, whatsoever, even the quality of life that people live is a factor, the choices they made. So it's either you are living your choices or you are living the consequences of your choices. And most of the time, sicknesses or illness are product of the choices we made in the time past. If you want to come from the side of diet, what you eat and how you eat. We talk about eating healthy, taking vegetables, don't eat a lot of fat, don't eat some particular kind of food. Some have predisposition to some kind of sicknesses and illness on the long run. So when you have that information, some people will make choices, right choices based on that information. And at the same time, you have people that will say that it's something will kill people, and then they begin to continue, But when you come face to face with sickness and disease, some will recant those kind of statements. So you make choices in the way you eat. You make choices in the way you drink and what you drink. These are some of the things. You know that these days we talk about preventive health, we talk about curative health, palliative, and some other means. So, and the way to live is to live preventive health, and that's why this question is a very good one. I wouldn't know where you came about that, but it's a very good one. So, in prevention, you have to make right choices in what you drink. You have to make right choices in what you eat. Ladies and gentlemen, you have to make right choices where you live. These are germane, to the way our health will come ultimately. Some you say to them, don't chew this, don't drink this, don't smoke this. Sometimes we listen, sometimes we don't listen. You have information in the space. Everybody knows what is right to do. Even people that do cigarettes, they will put it there. It's not good for people at a certain age, you know that, because they know that making those choices will have some consequences. You know, so that's in the area of what we eat and what we drink. You know, again, where you go to. Sometimes we contact illnesses, sicknesses based on where we go to, the people we mix with. I have somebody that came in from a trip abroad. He came in very, very sick. In fact, from the airport, they had to bring him to meet with me, you know, and we have to be prompt in the level of care we give, because you wouldn't know the kind of person he has mixed with. You wouldn't know it was the kind of respiratory illness when he came in, you know. So you wouldn't know the kind of people he is mixed with. You wouldn't know the environment, you know, the thing that he's been exposed to. So sometimes we go to certain places that we have negative impact, and where we go to, they are product of our choices. I can go, I can decide not to go. The same thing is where we live, especially with the economic situation, you know, and then our procurement power. You have find people that we go and live in certain areas that they have reduced contact with human beings. You know what I mean? Some area that are just developing, you find out that 2 or 3 of them are the first developers in that particular area. They have wives, they have children, they are surrounded, you know, by bush. You know, so these are choices we make based on our purchasing power. And some are actually wrong choices that at the end of the day, we impact negatively on our health. We have impact negatively on our children's health. I was talking to a young man about 2 years ago who was having recurrent swelling, you know, around the body. You have a swelling today, it goes, and then in 2 weeks. So I have to say, oh, where do you live? And so when he told me where he was living that time, of course, the reasons for all the swellings, recurrent swelling, you know, was not far-fetched. You live where you have a lot of bush around you, so you have the bite from this insect, bite from that animal, bite from this animal. So again, you can see what our economic situation, you know, can push us into. So we make such choices, and then of course they have a way they tell on our the quality of life, you know, that you are living for our mental health. It's a product of choices that we make. So I think these are some of the impact that our choices can make on the outcome of our life in terms of health, you know, and well-being.
Thank you, Doctor. So, well, I think health is wealth. It's a common fact, basic fact of life. But many still consider healthcare too expensive. Especially sometimes they neglect the risk that is associated with making preparation for accessing healthcare on a sustainable basis. Please, in terms of healthcare insurance, how do you think that people should approach this attitude so that they can leverage the provision of health insurance? Because many times they consider it too expensive.
Okay, so before now, and in future, health and care of our health is expensive. And I say that with all sense of responsibility, because you know that what we try to say now is that inflation, the situation now in the country and all, even before now, health and care has always been expensive. You know, and that's what we talk about. What is the WHO, you know, was talking about? What is the percentage of our income that I spend on our health? You know, they wouldn't do that research if They were not thinking about the impact of economy, the impact of our resources, on our well-being. There's no way you can lead a quality life. You can have a joyous life, a robust living, where you spend 70% of your income on your health, and that is the situation. That is, and we're trusting now that we started looking towards health insurance, that will begin to change. And so, because the greater percentage of the people living are spending the greater percentage of their income on their health, then we need to have conversation. We cannot continue like this. Whether the poor, whether the average, whether the rich, we are spending unacceptable amount of our health, of our income on our well-being. Taking care of ourselves, taking care of our families, taking care of our children, sometimes taking care of emergencies, even dependents around you. Because sometimes you want to take care of your neighbor so that thing will not affect you on the wrong run. So we are spending a lot. And so the health ecosystem and the concerned people begin to think, what can we do to reduce expenditure? What can we do to begin to make it possibly 50% of our income, and then fantastically to do 30%? So we now started thinking about healthcare financing. And so today, the best type of healthcare financing is health insurance. And what we are saying in health insurance is it possible to spend a minimal percentage of our income on our health and you still have quality healthcare? That's what health insurance is all about. And we now said that, okay, possibly I think about myself, out-of-pocket expenditure. Can we have a communal type of spending? And that's what health insurance is talking about. If we all put some amount of money down, we put it in a bag, we put it in a basket, even at the time that I don't need to see a doctor, at the time that I don't have an headache, at the time that I don't need a surgical intervention, but we make a practice, of putting small amount of money in a basket, as a community, as a group, as a people, as a city, as a nation, and then we put that money together, and that money will be available for any one of us that has taken heal to spend at the hospital at the appropriate time. That is health insurance. So I put money in a basket. So when I need to see a doctor, the problem that time will not be me looking for money, because I put money in a basket together with some people. So when I need to see a doctor for any reason, it is the basket that will take care of my ailment. It's not going to be my pocket any longer. That is the philosophy, behind health insurance. And so the more the people that put money in that basket, the deeper the level of care that I can receive, the more robust is the type of care that I can receive, and then the bigger the number of people that can receive that care. So that's what health insurance is all about. Let's have more money, and so we can take care of more people, and then we can take care of greater number of ailments that happen to us. If that pool is small, then the level of care that we can manage will be small. So as the pool begins to expand, as the pool continues to expand, so also we can say, oh, now we can take care of some level of surgical intervention. As it begins to expand, we can say, oh, we can take care of some cancer management. As the pool begins to expand, so no, we can take care of some spinal cord injury. So when we are putting that money together, our first concern is to take care of most common ailments. If 100 of us has put money in that pool, be sure that 80% of us, or the chances that 80% of us will have malaria, is higher than 10% of us even having spinal cord injury. So in health insurance, therefore, you want to take care of the most common ailment first. They understand that before you begin to talk about not too common ailment. But when the pool begins to get bigger, we can now move from most common ailments even to not so common, ailment. So that's the philosophy, behind insurance, and that is the philosophy all over the world. So gradually, the world is moving away from out-of-pocket expenditure that tends towards poverty, that tends towards hazardous living, to contributory scheme, where we all cater for ourselves. That's why some people will say health insurance is robbing Peter, to pay Paul. Because I take money sometimes from people that are rich. I put it in a pool and find out that the people that are not so rich, they still pay the same amount of money. In other words, if I had 100,000 and they said, let's begin to contribute 1,000. I haven't contributed as much as somebody that have 5,000 and is contributing 1,000 from his 5,000. And mind you, the two of us will still be able to access the same level of care. We'll still be able to access care from the same level of facility, and so at the end of the day, my well-being is the concern of the rich. The well-being of the rich becomes also a concern, of the poor.
Fantastic. So it's a mindset that has to shift actually, so that people can enjoy this on a sustainable basis. Thank you for that, Doctor. So this is Oyo State. Let's talk about Oyo State Health Insurance Agency. Your agency has a track record of commitment to the achievement of healthcare accessibility through health insurance scheme. Please tell us about Oyo State Health Insurance Scheme.
Okay, so we started this journey like a joke about 7 years ago, and today Oyo has become an household name in Oyo State. And I even can tell you in Nigeria, it's one of the leading, health insurance provider, in the country. And our objective is actually to be able to improve, expand access, to healthcare for every resident of the country. And so Oyo State Health Insurance Agency is pushing Oyo State Health Insurance Scheme. We are doing that because we want to achieve universal coverage. Hitherto, you have a lot of private scheme where you have tailor-made plan for people of a company, people of a community, and then at the end of the day, you find out that the premium, i.e., the money they pay on annually, is still out of the reach, of the common man. So that's why Oyo State Health Insurance started Oyo State Health Insurance Scheme, I think May 2017, with a view to providing access, to every resident of Oyo State, and that we've done reasonably well. We're about 5% of the population of Oyo State. We haven't reached it, but we are making progress on a daily basis. we have a premium that is today 13,500, and of course we have top up, and then for pre-existing illness we have a plan of 50,000. And that plan is 13.5 is what we push for universal health coverage. And today we are almost at 300,000 lives, in Oyo State. I was saying the other time that gradually we are hitting 5% of the population of Oyo State, and that plan covers conservative management, surgical intervention, specialist care, admission, and all, and today we've had quite a lot of intervention, via Oyo State Health Insurance Scheme, in terms of delivery by pregnant women, in terms of various kind of surgical intervention, for our enrollees. We've done things in the eyes of the people, hairs, ENT cases, and no. So we're doing relatively well. We can do better, but the scheme is changing in the face, of healthcare delivery in Oyo State. Our services had impacted through capitation we paid, had impacted many hospitals in Oyo State, both public and private. So hospitals are be able to renovate, they'll be able to buy equipment, they'll be able to employ workers, to add to the workforce they have in those facilities, and all they do through the capitation, that we pay them. So in nutshell, Oyo State Health Insurance Scheme has brought a lot of changes, to healthcare delivery system, in Oyo State.
Thank you so much, Dr. Olushola, for shedding light on the vital role health insurance plays in helping people to access a balanced, healthy, and a sustainable lifestyle. Your insight this today has actually enriched our conversation on this show. Thank you once again. But before we let you go, sir, please, we'd like to have any word of advice or encouragement for our viewers on embracing an eco-friendly lifestyle, particularly their choices, their attitude towards the environment, and also how they can secure their health through accessible healthcare insurance, like what Oyo State Health Insurance does.
Okay, so I'm going to round up the way I started, choices. And I want you to know that Oyo State Health Insurance Agency is in sync with what you are doing, because any reasonable agency will be strong on prevention. I want you to come, pay your premium, but I don't want you to be sick. I don't want you to go to the hospital. And that is why any reasonable agency will do a lot about environmental friendliness, the eco lifestyle that you are talking about. Clear the bushes around your houses. Don't allow stagnant water to be around your houses. Those will predispose you to malaria and some other infection. You will go to hospital, and then you go and collect drugs. And I don't want you to go. So I will always say, join forces with any organization, whether governmental, non-governmental, that want to promote environmental cleanliness. Don't put your waste, in the middle of the streets, which predispose people to infection. I will campaign against open defecation. Use public toilets when you want to defecate, when you want to urinate. Make sure that you don't have stagnant water in your environment. I will talk about good roads that will reduce road traffic accidents. Your state is doing a lot now, renovating the roads. So I will, an agency of insurance will always promote, good environment. We promote, we talk about health prevention, health promotion and all. And that's why actually we actually welcome the effort from your NGO, in this particular choice that you made. And okay, again, I would say people need to make a good choice in coming into health insurance, especially Oyo State Health Insurance. I was talking to a population yesterday, and I was saying that Nigeria had moved away from saying free this, free that, free health, free cesarean section, free consultation, free medication. That was 10, 20, 15, 30 years ago. What we are talking about now is healthcare financing, health insurance. You can have subsidized premium. You can have adoption model where people will pay, for your insurance. But we should not say that there's free health. Somebody is paying somewhere. And so today, buy into Oyo State Health Insurance. Especially, I want to let us know that our premium from January is changing from 13,500 to 18,250. So make the right choice now. Buy Oyo State Health Insurance. In fact, you can subscribe for 2 years. You can subscribe for 13 years. You can buy for you, buy for your family. Our family plan of 4 is 40,000. 750. Our family plan of 6 is 60,000, 250. So buy family plan either for 6 or for 4, or you can buy for yourself. And I want to say to people that are getting married, part of the gift you will have, buy a family plan, now. Because what we see is most of the time that people will wait, and when they are pregnant, they are coming. The moment you are pregnant, you will not buy a plan for 13.5 or 18.5 if we are talking about January. You will come on our pre-existing issue plan, which is 50,000 naira. So buy now so that the consequences for you will be a good story. Thank you very much.
Thank you, Dr. Olushola. So it boils down to taking responsibility and being intentional about it. It's been a wonderful moment with you, sir. We really appreciate your time.
Thank you very much.
Thank you.
Hello, Lara. Please, where are you? Junior is really sick. They need to want to fund hospital bills there. Please, I need you to borrow me some funds. Yeah, I'm in the office. Okay, thank you.
Ọ̀rẹ́, how are you? Kí ló ṣẹlẹ̀?
You are okay.
Kí ló ṣe? How is Junior?
No, he's not getting any better.
Ìwọ gan lè ṣé kí tó fi lè nìyẹn?
I've spent all my entire savings. I don't have any money. Don't worry me.
What do you mean by you spent all your entire savings on hospital bills?
I don't have any money.
You don't have any money. It's not just to go to hospital and receive treatment and come out with your son. You went to pay, báwo? Hey? Wait, hope is not what I'm thinking. So you're not on any health insurance coverage? How do we not change it by? Me and my family, we just for 7,250. We have health insurance and it covers us for a year. Even the last time that I wanted to do CS with my last born, I did not pay any money. It was free. So you've been spending out of pocket and you're saying you don't have money. What are you going to do now? Okay, let's first go and see your son.
Okay.
But you must go to Oisha office at Secretariat.
Right away, I will do
Secretariat Agodi.
No problem.
Then you register your family and yourself.
Alright.
For this, you need treatment.
Before to see a doctor, you must pay money first. Today,
While we are at this, let me tell you a secret. If you are waiting to get a health insurance plan when you need it, it would have been too late. So, call these numbers on your screen or send a DM to the social media platform. Someone will be waiting to guide you on how to get a health insurance plan that suits your needs.
eyes treatment, dental soon call. Oh yeah, register today. Yeah, Oyo State Health Insurance Agency. Oisha Betutunde.
Again on the show is an important representative of the agency, or your State Health Insurance Agency, Mr. Stephen Dowder, Director of Marketing or your State Health Insurance Agency. Thank you for coming on the show.
It's a pleasure. Thank you for having me.
Sir, you are the front line of interaction with everyday people, talking about meeting with all kinds of people and bringing them on this scheme, helping them to access affordable health care. Sir, how are you doing it?
Kò sí ọgbọ́n kan tuntun tá à ń dá sí i torí pé àkọ́kọ́ ètò yìí ètò tó ṣe pàtàkì ni. Tí ẹ bá gbé nǹkan tó ṣe pàtàkì lọ́wọ́, gbogbo èèyàn ni ó fẹ́ darapọ̀ mọ́. Bó sì ṣe wá rí, kò sẹ́ni tí ò nílò ètò ìlera. Ọmọdé ni o, àgbà ni o, arúgbó ni o. Pàápàá jùlọ nǹkan tó máa ń jẹ́ kó yé àwọn èèyàn ni pé ibà tí ó mú olówó ni ó mú tálíkà. Ibà tí ó mú olórí orílẹ̀-èdè ni ó mú akúṣẹ̀ pátápátá. Ibi tí wọ́n ó ti gbàtọ́jú nìkan ló lè yàtọ̀. Olówó lè gbọ́n páálí ẹ̀ kó sọ pé òun lọ òkè òkun, ṣùgbọ́n tálíkà kó wà Nàìjíríà wáyé, ṣùgbọ́n ibà ní ibà ń jẹ́. A rí pé nǹkan kan tó kó gbogbo wa pọ̀ ni. Àwọn olóyìnbó ní ailment is a leveler. Àìsàn ò sì ní béèrè pé ṣé o lówó lọ́wọ́ kí n tó wọlé, tí ó bá mú yàn ni kó mú yàn. Ìdí nìyẹn tá a fi ń jẹ́ kó yé wọn pé ká ní ètò adójútòfò ìlera ó ṣe pàtàkì. Ìyẹn ni ò ní jẹ́ kí àkóbá àkùdé kó bá ìwọ̀nba owó tá a bá ń pa. Ọgbọ́n tá à ń dá sí ni.
Wow. Thank you, sir, Mr. Stephen. So, I've been thinking lately that how easy it is for people to enroll on this program. Because most times people complain about the economy. Things are too expensive and they want to put that money back. They want to hold on to that money. Rather than, putting it in this pool that your agency has provided so that they can access healthcare on a sustainable basis. So how do you get people to eventually, subscribe to various plans and packages?
Okay. The answer to your question is not far-fetched. It's making them see that in our own little way that the government is trying, putting some policies in place. Now, let me give you an example. I was in a gathering a few weeks back, and I asked them, how is the country? The country is tough. Okay, agreed, the country is tough on everybody. Then is the government making any effort? They said no. And I made them realize that yes, in the area of health, in Oyo State, government is making effort. And some people ask me, how? I explained all the processes and benefits of your state health insurance, of subscribing. And most of them say, wow, so such a thing exists in your state, that with as little as 13.5, you can take care of anything that has to do with your health for a year. Yes, I agree, it might not cover everything 100%, but at least if you need 100,000 for something, and you have a scheme run by the government that will give you 70 or 80,000, at least your burden has been reduced considerably. Right. So, and that is the joker, if I'm permitted to use such a word. We let them realize that why not try it and see. We are not forcing you. If you key in for a year, you feel you are not satisfied, you can pull out. But what we've seen is, even people now come back to us that, why didn't you inform me on time that my 1 year is about to elapse? Because they're enjoying it. And also, one key factor, yes, ailments will come whether you like it or not. We make them realize government is now focusing on preventive care rather than curative, because preventive care is far, far cheaper compared to curative. And what preventive care simply means is you have access to go to the hospital as often as you need. We don't even want you to fall sick, but you can nip those ailments in the bud before they become something big. Because we know it's because of money. Most people don't go to the hospital. They patronize different avenues to get themselves treated, even miracle centers, so to say, you understand? And when those situations become worse, they will now come back to the hospital, spending a fortune. But all this can be prevented if you imbibe the culture of going to the hospital regularly for simple tests, checkup and all that. You see that you know what is coming before it comes. And those you can nip in the bud. You do that before it becomes something big. These are the benefits inherent in health insurance.
Thank you, Mr. Stephen Dauda. So prevention is better than cure. Like you has rightly said, come and see, come and try. Thank you. So please just give us a parting word before we conclude.
Okay, for all those listening to me, as you are hearing this, tell your loved ones, tell your friends, even those you consider your enemy, because you know when anything happens to them, it will still affect you one way or the other. Let them know. You can also go on our sites to read more and acquaint yourself on the benefits of health insurance, and most especially your state health insurance. It has a lot of goodies for you. Once you are on the scheme, you are helping yourself, helping your finances, because the scheme will help you to save more money, which you can use for other things. You are helping your neighbor. That your neighbor might not be somebody you know. All those on the scheme like you will now become neighbors. And you are also helping the health system, because the premium you pay will serve everybody. Just like every other person's premium will be of service to you when the needs come. So be on health insurance will do you a whole lot of good to keep you in good health and uphold your finances.
So you've heard it from Mr. Stephen Dauda. Be on the scheme so that you can continue to enjoy a sustainable healthcare. I'm sure our conversation today has been an eye opener for you. Kindly like this video, share your thoughts in the comments, and subscribe to our channel so you are notified whenever we post other inspiring stories. Thank you. So, Mr. Stephen, thank you for coming on the show today. You've really enriched our conversation. God bless you.
Amen, and it's a pleasure being here.
Kíni Alabi. Alabi ó ti dé o.
Ó náà dé.
Alabi, ìyàwó rẹ ti lóyún o.
Ìrọ̀rùn ló bá dé. Àṣàbí. Àṣàbí. Àbí àsìkò ti tó ni.
Tí ẹ mọ̀, bóyá ká mọ lọ sí.
Ọ̀yẹ́ bí a máa lọ.
Alabi, iṣẹ́ abẹ la ṣe fún ìyàwó rẹ.
Ìrọ̀rùn ló bá dé.
Alabi, ìrọ̀rùn ló bá dé.
Bá ọmọ Bọ́lá. Wọ́n mọ̀ ti fowó kówó iléèwé àwọn ọmọ Bọ́lá.
Ìrọ̀rùn ló bá dé.
Orúkọ mi ni Àlàbí ọlọ́kadà.
Ẹ jọ̀ọ́ kí gan-an ló bá rọrùn dé.
Gbogbo ẹ̀ náà ló bá rọrùn dé.
Ẹ jọ̀ọ́.
Hello.
Káàdì ọ̀ṣẹ́ àtẹ ìṣàgbàtẹ̀rù fáwọn obìnrin ó ti wà nílẹ̀ báyìí kẹwàá gbà báyìí.
Ìrọ̀rùn ló bá dé.
Bẹ́ẹ̀ ni àǹfààní ọ̀ṣẹ́ àti wá gbìnàyà báyìí o pẹ̀lú ẹgbẹ̀rún mẹ́tàláàbọ̀ náírà 13,500 naira fún orí kan tàbí 47,250 naira fún ẹbí ẹlẹ́ni mẹ́rin tàbí 60,750 naira fún ẹbí ẹlẹ́ni mẹ́fà. Ìrọ̀rùn ìlera bí ọ̀fẹ́ fún ọdún kan gbáko ni. Ìfọ̀kànbalẹ̀ aláìlẹ́gbẹ́ ni fún ọ láti lè ṣe ọ̀pọ̀lọpọ̀ nǹkan míì pẹ̀lú ìrọ̀rùn. Kàn sí àjọ ọ̀ṣíà ní sẹkítẹ́rìàtì Ìbàdàn tàbí lórí ẹ̀rọ ìbáraẹnisọ̀rọ̀ wọ̀nyí 0805-700-0530 tàbí 0903-000-0530. ọ̀ṣíà dé ìrọ̀rùn Ọ̀yọ́ dé.
Also on the show today is the Deputy Director of Enrollment and Underwriter, Oyo State Health Insurance Agency, Mr. Fashida Akintayo. Such a pleasure to have you on our show.
Thanks for having me.
Right, so unarguably, Oyo State Health Insurance Agency is on the top of the provision of affordable health care for everyday people in Oyo State. We're so proud of what you're doing. And particularly your unit that brings people into this provision. We want you to just share with us what role your unit plays in ensuring that everyday people continue to enjoy this provision on a sustainable basis.
Thank you very much for that question. Well, part of what we do in the enrollment unit is to ensure that all the lives that are captured are properly enrolled with regards to the plans that they have chosen. Our plans are very affordable, and so we ensure that the plans that you have bought is in proper alignment with the premiums that you have paid in the enrollment unit. It will be a mismatch to put you on a plan, for which you did not pay for. So our plan, the cheapest of our plans as at today, it goes for 13,500 naira per annum. And the plan covers several benefits. You can consult your doctor, you can take a lot of tests, you can do some surgical interventions, you can have full cover for maternity services if you are a woman. So there are a whole gamut of things that are covered under that plan. So in the enrollment unit, we ensure that you are properly registered. Once you are registered, we issue you a certificate of insurance to be sure that, you are properly covered. Then we give you a list of your benefit package to show you what exactly that you have bought. And then we also give you your identification card. Now, this identification card allows you access anytime you go to the hospital if you are ill. So once you get to the hospital, part of what we have done is to have sent your names ahead before you got to the hospital. So once you present your ID card at the desk office or at the front desk of the hospital, they would immediately check with the list that were forwarded to them and then recognize you. So it already shows that you are eligible for the health insurance that you are covered for. So with that, treatment commences. So at the enrollment unit, we ensure that everybody is not left out for all the registration that you come to do there. Now, we also have people who are registered on high-end plans. We have standard plus plans. That's the one that goes for 13,500. We have standard medium plan, which goes for 50,000 naira per annum. And then we have the standard peak plan, which is like a top-up plan. And that goes for 108,000 naira per annum as well. So everybody can cut their slice from whatever it is their pocket can hold and can afford.
Thank you, sir. So it's obvious your unit is the go-to place for, enjoying this provision. Thank you so much, sir. So can I ask one more question before you go, sir?
Okay.
So what are the things that are the requirement for a potential enrollee to access these provision the agency offers?
Okay. For you to have access to insurance at Oyo State Health Insurance Agency, there are certain documentation that has to be done. Number one, we capture your biodata. Number two, we require that you register with your national identification number, very crucial, without which you can't get registered. Alternatively, you can provide the voter's registration number, or you can provide a driver's license number. But principally, we register with national identification number, very crucial. Then you have to have a passport photograph. If you don't have a passport photograph, the enrollment unit is equipped to take your photo on the spot. And so you don't need to worry about that. And then we have a network of hospitals that you can choose from. Now, you can choose from hospitals that is close to where you're living, or you choose from hospitals close to where you are working. Depends on where you find yourself most of the time. So with that, you fill out the registration form. You don't always have to come to our office to do this registration. Sometimes you can just go to our portal, oshiaportal.com, and register online. Or you can just visit our website, oshia.oy.gov.ng. So at that website, you can also do these steps of registration that I'm talking about, and very conveniently. So once that is done, almost immediately, we issue you this ID card for you to be able to access care at your hospital with all the documents that comes along with it. So that's
Thank you, sir. So I've been having discussion with Deputy Director Enrollment and Underwriter of your State Health Insurance Agency, Mr. Fashida Akintaya. Once again, thank you so much for coming on our show.
Thank you for having me. I appreciate it.
So this morning, I have on the show with me Mrs. Idris, a Client Service Officer of your State Health Insurance Agency. Thank you for coming on the show, Mrs. Idris.
Thank you, sir.
So please tell us about your unit and how it has been significant in advancing the work at the agency.
Thank you, sir. The Client Service Unit is the entry point for all prospective enrollees. We recommend our plans to clients when they want to join the scheme. We talk to them about the different plans we have. Then we also talk to them, we recommend plans for them based on their medical condition. That is, we recommend the best plan that fits their medical condition. Yeah, that fits their medical condition. Also at the unit, when enrollees wish to change their primary provider, their hospital, they come to the unit, we give them the list of hospitals we have so that they can choose their preferred hospital. Then at the unit, we also attend to complaints from enrollees, in the sense that when enrollees, they get to their primary provider, their hospitals, and they have complaints about services at the hospital, they put calls through to the customer service line, written at the back of their ID cards. So immediately we address the issue. We always, at the unit, we always encourage enrollees to call the customer service lines before they leave their hospitals so that issues they have with their provider can be addressed immediately. Also at the unit, we have a call center. At the call center, we have a total number of 3 staff members. The work of the officers, the staff members, is to attend to complaints from enrollees as well. They receive calls from enrollees, and they also call enrollees to know if they enjoyed services at their hospitals, and to also know if the enrollees expended cost out of pocket while they were at the hospital. At the call center, we also put calls through to enrollees to remind them about renewing their plans. Through this process, enrollees will be prepared to renew their plans before due date so that they can continue to enjoy services at their chosen hospitals. The Client Service Unit has really helped our enrollees. At times, some enrollees, they call to seek for our assistance towards helping them to renew their plans. We help enrollees to renew their plans without coming to the agency. Then there are some surgical intervention that, if not for the help of the agency, some enrollees would have lost their lives. But through the Client Service Unit and the help of the leadership of the agency, our enrollees, they've really enjoyed surgical interventions. If not because they are under the scheme, they wouldn't have been able to afford cost for the surgical intervention.
So, Mrs. Idris, so I'm sure at some point in time you've had cause to receive testimonies from some of these enrollees. Can you share a bit of their success, their testimonies?
Thank you, sir. We have testimonies from like, let me say, more than 100 of our enrollees. Some enrollees, they've undergone CS. There is a particular child that was operated on at one of our hospitals. If not for the agency, the child would have lost her life. But the parents, they were able to, the child was able to undergo this surgical intervention through the help of the agency. We also have some pensioners that have enjoyed the scheme. Some, through the help of the agency, the huge medical condition they had, through the help of the agency, it was resolved. A lot of our enrollees have really enjoyed the scheme. We have done different cesarean sections. We've done different angiography, myomectomy on the scheme.
Thank you, Mrs. Idris. It's obvious that the work at the agency is really advancing and is ensuring the sustainable accessibility to healthcare for everyday people. Such a huge work that you're doing at the agency. Thank you for coming on the show.
Thank you, sir.
Thank you, Mrs. Idris. Thank you for joining us on today's journey to an eco-friendly and healthy lifestyle. Remember, every small step, reducing waste, conserving energy, or choosing sustainable options contributes to a healthy planet and a better you. Pair your eco-conscious habits with accessible healthcare through the Oyo State Health Insurance Agency. With their commitment to quality healthcare coverage, staying healthy has never been easier. A healthy lifestyle and a reliable healthcare go hand in hand to improve your overall well-being. Take action today for yourself, your family, and the future. Stay green, stay healthy, and we'll see you next time.